Hi, my name is Guinevere Ray, and I'm making you this short video so that you can understand what it is to be a facilitator in a self-directed learning session here at Tulane School of Medicine. Why are we teaching medical students self-directed learning? We are trying to get a medical student to shift the responsibility for their learning process from the faculty-centered role to a more self-directed role so that they can mimic what they're going to be doing later on in their careers. They're going to be encountering patients in their third year, fourth year residency and beyond that are going to need or stimulate them to do research and come up with new approaches and new answers to patient problems. And so we want to start that process early in their medical school training so that we can help them develop these skills so that they will continue to develop and use throughout their careers. The steps that are included in self-directed learning include the first step of identifying the unique learning needs that each student has. So when you're presented with a problem, in this case, the most relevant problem would be a patient problem, the medical student needs to decide how much more information they need to gather about that particular topic so that they can make an educated decision. So they're going to identify what their learning needs are and make goals that are unique to them. Then they're going to find resources that are going to help them learn how to reach these goals and solve these needs. Then they get an opportunity to share what they've learned with their peers and faculty members so that they can see how good of a job they've done at putting all the pieces together. And they also need to get formative feedback on whether or not the resources that they use to make these decisions were appropriate to match the patient problem. So here at Tulane, we have a specific process that we use, which you'll be a part of as a facilitator. At the beginning, a faculty member creates a unique case for the students to research. The students go off and find resources, and they learn independently according to their unique learning needs. Then the students will meet in groups, and this will be the session that you'll be involved in, and they get to share their findings with their peer members, the fellow students, and the faculty members that are there, and you as a facilitator. And then they also get feedback on how good of a job they've done researching their patient problems and reaching their independent learning needs. And this is done by the library. Your role is really here as a faculty member, which we use the term facilitator because we have faculty and we have peer teachers that are all coming together to help students learn self-directed learning. So what you are going to do as a facilitator is have a small group of students within the room that you will guide a discussion with these students. So you're going to be a guide to their discussion, and you'll have approximately 5 to 6 students in each group. You'll get a sheet that will have all your facilitator questions on there, and these questions you can use to probe the students and stimulate the discussion if this discussion starts to kind of wind down. You don't have to know all the answers to these questions. These questions are provided to you by the faculty member so that you can use it in class just to help kind of probe the discussion. You will also help identify students who are having trouble with the self-directed learning process, or they may be having trouble with the in-class discussion. They might not know how to approach the situation, or they may just not be participating. And so you can help guide them and engage them during the discussion by asking them some of these specific facilitator questions and sort of get them involved in the discussion if they seem to be sitting back and not really being an active member. What you don't have to do as a facilitator is give them all the answers to the case. The faculty member will be present, and that faculty member will be the one who's steering the content-driven answers to the patient problem. And you don't need to know everything about the case. It's okay if you have limited foundation knowledge on the case material. It's more important that you help drive the discussion and move the discussion along and make sure the students are engaged during the session. And you also don't need to bring any materials with you. We're going to provide all the sheets of paper and provide copies of the case so that you can look at it while you're there in the room. Thank you in advance for your participation. If you have any questions, feel free to email me and I will respond.